Hey guys, this is Dr. Nima, physical therapist with Pro+Kinetics, Physical Therapy and Performance. And we are back with another Anatomy and Pathology series. And this time it's probably going to be the most important topic and one that, a lot of people might be asking about. And we're going to cover the lumbar disc pathology. Um, so It's probably the most common injury in physical therapy in general, not necessarily the disc, but just low back pain in general. But we want to get more specific and dive a little deeper into the disc pathologies, since in our case, that seems to be more common because we are working with a lot of people that are active, that are lifting a lot of weights, or they play sports, whether it's professionally or recreationally. So just going to go ahead and add some layers here so we can get an idea of what's going on with the disc. And just to kind of kick it off, I'll explain what the disc is all about. And it's basically this fibrous thick layer, or a bunch of layers, that makes up this disc shape that helps absorb forces that are put through the spine, and it also allows for a little bit of range of motion. So anytime you're moving or bending, it kind of absorbs some of the shock and helps distribute that load throughout the spine to help your body move. A portion of that disc also acts to provide stability to the spine and the spinal column as well. So I'm just going to go ahead and peel back this ligamentous layer here, and you'll see right in between, and everybody's probably familiar with these guys, but those are our discs. And this outer layer, it's called the annulus fibrosus. That outer layer is what gives us that kind of thick supportive structure. And inside of that is where the disc is going to sit, which is kind of hard to see in the app, so I won't dive a little deeper there, but we'll kind of move forward from here, and I'll pull that ligamentous layer back because it's important, and that's kind of what we're going to touch on next. So basically that ligamentous layer, you have so many of them. If you take a look here, I'm just going to spin this guy around. You'll see the disc highlighted in green right over here. And it's protected by this anterior longitudinal ligament. And then we'll kind of swing around here, highlight the disc again. And you'll see all these ligaments that are protecting the spine. So we've got this ligament right here, that's the interspinous, and that runs through each spinous process all the way through the whole spine. And you've got all the capsular type of ligaments that basically meet at the joint level between the spine. And then you've got the ones in between the transverse processes, and that's the intertransverse ligament. And then, of course, we get down to the SI joint, which is a whole nother area, but that is the sacroiliac joint, where your pelvis meets the lower part of your spine, which is the sacrum, or as people may know, it's the tailbone, but it's still part of your spine. And so we won't dive deeper there, but you can also see like the ligamentous structures that run up and down across in this big one right in the back right here. So we'll get to that in a later video. But back to the disc here, and I'll highlight it again. You can see that the disc is basically in the back, kind of exposed, very protected in the front. So essentially, you never will see an anterior disc injury, although it can happen, it's rare, but mostly it's either going to be lateral, which is off to the side, or posterior, which is coming through the back. So this area is commonly injured because the amount of forces that can be placed on the spine can be pretty high, and these forces occur during movements including like lifting heavier items off of the floor, lifting weight overhead, rotating quickly through the spine and not using your hips as much, or leaning over at an awkward angle, kind of twisted up a little bit through the back, and then trying to stand up quickly or maybe lift something in that awkward angle. Disc injuries can include disc bulges or different levels of herniations, from a slight protrusion to what's called an extrusion, which is a displacement of the disc material beyond the space where the disc is actually sitting. So those can be pretty extreme, and we won't dive super deep into extrusions because I guess in percentage-wise, I would say a large percentage of what we see are maybe lighter bulges or medium-sized bulges. So common complaints of disc issues include pain with sitting for longer periods of time if someone is working on the computer, but may or may not decrease when standing up or walking. Bending forward, pain with sneezing, coughing, or bearing down. And then radiating numbness or tingling or even burning into the glute, hamstring, but symptoms that also go down into the calf and foot. And when we hear that, we think more of a disc-related issue compared to something else. If these disc injuries get more severe, you could potentially have a loss of sensation or strength. And typically these cases are the ones that don't seek out any early intervention, including physical therapy, to address these symptoms. It's common for a disc injury to show up on an MRI. However, there's a large percentage of healthy individuals that get imaging done and end up showing disc issues on their images when they actually don't present with any symptoms at all. So, just because the MRI shows that there's a disc issue doesn't necessarily mean that it's the source of your pain. Usually, it's secondary to something else that caused the disc issue in the first place. One of the things could be what I mentioned above, which if there's an awkward twist or you're lifting something heavy, could be a postural related issue and a lack of stability or strength of the hip and core muscles. Could be a loss of flexibility or mobility in the hips and specifically the hip flexors. And I've mentioned this in an earlier video, but we'll kind of talk about some of these here. And I'll pull forward these hip muscles. So you got the hip flexors, one of them being the psoas, the other one being iliacus, which they cross the pelvis and they meet at the hip right here. And then you've of course got the rectus femoris, which sits on the front part of the hip itself. So that sits on the front of the hip joint, and I'll just isolate it here for you so you get a better view. You can see that there. And then the other thing could be that it could potentially be a nerve entrapment. And so this is pretty common in disc issues where people will say that you got some numbness and tingling, as I mentioned above, or a little bit of burning or pain down the leg. And these radicular or radiating symptoms could actually be coming from the disc infringing upon the integrity of the nerve. Or it could actually be a nerve entrapment along the way. It may not actually be the disc hitting the nerve, but it's the disc issue, again, as I mentioned, is secondary to something else along the way that's causing these symptoms. And that's what we do as physical therapists is we'll dive in a little deeper to the issue, and we'll do some tests, and we'll look at your posture, and we'll look at your movement, and we'll try to reproduce some of the symptoms and do some mobility type testing and kind of put the pieces together and really try to isolate to see if it's a true disc pathology or if it's something else causing your symptoms. And I just pulled up the nervous system here so you can see pretty significant in terms of all the different neural connections that are going throughout the body. And it's pretty hard to directly isolate exactly what nerve, but most of the time we're able to, and it's because it usually presents in a specific way. And that stuff will be explained to you during your initial evaluation. So, just as an example, I'm going to dive all the way into the spine here, and we're going to take a look at this fourth lumbar nerve root. So you can kind of see where the fourth nerve root sits, and I will isolate it here, and you see how it exits below. So what's happening is this is the L5 vertebrae. No, I can't click it. Here we go. L5, L4. So usually if there's a disc issue, they talk about it's the L4, L5 disc. And that will usually affect the L4 nerve root. So you can see that kind of, that nerve root exiting just below L4 right there. So if the L4 nerve root is affected, you can get some of the symptoms down the lower part of the leg. You may get some sciatic type of symptoms where you get it in your glute, into the hamstring, maybe some of the inner thigh. So the nerve distribution can be pretty complex. Oops. But I think in the grand scheme, the idea is that if you are having nerve symptoms, then we would be looking to see if it's a potential disc injury. And one thing that may actually not be well known is that the disc has a pretty good capacity to heal. So, regular and appropriate exercise, which is the key here, and the appropriate part and the appropriate progression would come from us as physical therapists. Mobility work, core stability, and just general lumbopelvic strengthening, which is the lumbar and the pelvis as a whole and all the muscles in the area, can significantly improve these disc symptoms. And as you guys know, at Pro+Kinetics, we perform a full body diagnostic. This includes an extensive evaluation of the problematic area, manual therapy techniques to help relieve your symptoms, and of course, an exercise routine, which is the ultimate goal to help maintain relief, improve your mobility, and strengthen your weak muscles to prevent the problem from returning. Thanks again, guys, and we'll catch you next time.